This is the view the outside world has of Africa. Always dangling the begging bowl, waiting to be rescued, burdened, passive, abused women, malaria, war, hunger, famine, corruption, floods, and Ebola. Ebola claimed 11,315 lives, the majority of whom were women. In Sierra Leone, at Kenema Hospital alone, we lost 38 health workers. The First Lady of Sierra Leone, together with UN Women, launched a free health initiative to restore confidence in the health delivery system of the country.
The pregnant women were afraid to come to the hospital. We lost 38 of our staffs, including doctors, nurses, porters, and the cleaners. But the First Lady initiative is a very big blessing. When it was introduced in March, the caseload of this ward has been increased. When this initiative was launched and education was given to the women over radio, a team was formed. They sensitized the women. Since then, the women started coming to the hospital. So the caseload, even to now as I'm talking to you, is increased every day.
We do practice infection prevention and control. In fact, there is a team in the hospital, the infection prevention control team, and they monitor every day. They monitor the nurses, even at night. If you protect yourself, you will protect your community. We are more than 200 days with no case in Kenema.
I'm proud to say a lot of support came from member states. We're able to mount a response, sending medical doctors on the ground. Although at the time nobody wanted to go there, they would send money, send equipment, send everything, but we needed people on the ground. We needed people to nurse those patients. We needed doctors to treat those patients. So the African Union and some other partners reacted very quickly, and they sent a team of over 800 medical doctors, nurses, epidemiologists, and all types of health personnel. In fact, the whole team was nearly 1,000 with the other advisors that we had on the ground at that time. Now, what about financing? We tapped on the African private sector. And to date, the bulk of the response came from finances from the private sector. Now, even when we've reached the point of looking at post-Ebola era and see what we could do to make sure that we're ready if something like this comes in the future, again, the financing is significantly done from within the continent.
The lessons from the Ebola virus disease is with African solidarity and resolve, we can find solutions to our challenges.
Gender-based violence raised its ugly head.
She was paralyzed and could not move.
They opened both her legs and they burned all her private parts.
They raped her and abandoned her in the forest.
Africa and its women rose to the challenge, and we turned it around, protecting our women and girls from gender-based violence and protecting their sexual and reproductive health. In Ethiopia, the women's shelter in Adama is a beacon of hope for women subjected to gender-based violence.
When I was a judge, I see, women come without being represented by a lawyer. The other party has a lawyer because he has money, and they couldn't explain their cases because they don't know about the law. So that gave me something, I said, why not? Why don't we have Women Lawyers Association who could give support to women? When we give a legal aid service, what you see is the women will come for a legal aid service, but they will say, where am I going to stay today? As a woman, it touches you, Somebody with a kid, with having no shelter, having no food for her kids, even for herself, and being even vulnerable to another violence, staying at a church area or on the street, it touches you a lot as a mother and as a woman. And a group of us, we had a campaign and we said, why not? I thought that we should have a safe house. And we had a big campaign, and after that, we opened a safe house.
My name is Tigis Kabede. When my mother and father died, I started to live on the streets. I used to be a day laborer and live in a rented house. The house I used to live in was in a secluded area. One day, when I was going back home, 2 men forced me and raped me. After a while, I started to feel tired. I used to vomit, and my stomach started to get big. I then couldn't work, and because of this, I started to sleep on the streets around the church. One day, I was so frustrated that I tried to commit suicide by taking a rat's poison. The police were then called, and they then referred me to the safe house in Adama. I have benefited so much from the safe house. To begin with, I was able to know myself. Before I came to the safe house, I had a very low self-esteem. I've also received several counseling services which helped me to reconnect with myself. I've received skill training in catering, and now I use my skills and work in this cafeteria. I've also been supported to give birth to a healthy baby and raise my child. I now take my child to the daycare in the morning, work here during the day, and take back my child after work. When I left the safe house, I was provided with seed fund to start my life. The organization also gave me several materials for my house. I left the safe house as if I left my own mother's house. I have no words to express what this means for me. The safe house was all about coming out of the darkness into the light. Anyone can fall down and still get back up. It was the low self-esteem I had and the problems I faced that put me down. But now I know myself. I know now that I'm a strong woman.
We have touched the life of 5,250, more than 5,250 women's lives, different ages, very young, old, middle age, many of them. You can see the result of the safe house. If the safe house was not there, these girls could have ended up on the street. We can do it. We can change our life and others' life.
Notwithstanding the challenges, this is the reality of Africa. We are grateful for the help the world gave us to beat Ebola and for the support to end violence against women.
Ireland's global development policy includes a commitment to reduce gender-based violence. Women take ownership too of this goal and put some substance into it.
Now is the time to tell our story and chart our own course.
Over the years, we've allowed ourselves to be dictated upon. And this dictation, most of the time, has to do with financing. You know, we talk about he who pays the piper names the tune. But we are now talking about significant domestic financing ourselves. If we are able to do that, then we'll change the narrative completely. Because then we'll be able to dictate our own programs, tell our stories the way we want to tell them, have our programs with our own priorities. You know, so I think the most important thing is for us to be able to finance these programs ourselves. And I think this is something that we can do. The most important part of the African Union vision is the one that says whatever we do should be driven by its own people.